Breastfeeding is every baby's birthright, and we do celebrate this very right in the first week of August every year. I'm Dr. Sophia Rodrigues, gynecologist working at Manipal Hospital.
And I'm Dr. Nathaniel Pinto. I'm the pediatrician here at the Manipal Hospital.
Today, we are going to discuss some myths and facts. So, the first myth is babies require water with milk. Is it true, Dr. Nathan, in the first 6 months?
This myth is a very common myth and often asked by parents, but it is absolutely not true because mother's milk contains 80% water and that itself is sufficient to take care of the baby's water needs. So you do not need to give any water extra besides the mother's milk.
So, the take home message is exclusive breastfeeding in the first 6 months of life of a baby.
The second most common myth is formula milk as good as mother's milk, and can it be a replacement for mother's milk?
Absolutely not, because mother's milk has everything that a baby requires, whether it is enzymes, antibodies, and growth hormones. The baby can actually grow very well with the mother's milk itself, and nothing else besides the mother's milk is required in the first 6 months of life. Dr. Nathan, the next common myth is many times our mothers get fever. Do you think that the mothers should stop breastfeeding when a fever is there?
Absolutely not. In fact, breastfeeding is protective because it passes on antibodies to the baby, which can help baby fight the infection. So the mother should not stop breastfeeding and in fact has to continue feeding during a viral fever. So Dr. Sophia, do you feel the baby should be fed on a strict schedule like every 2 hours for the first 6 months of life?
For the first 2 weeks, the schedule has to be every 2 to 3 hourly during the day and during the night every 3 to 4 hourly. Thereafter, the baby can be fed on demand.
Yeah. So the take home message I would like to give is that the baby has to be exclusively breastfed in the first 6 months of life, and the breastfeeding has to be initiated as early as possible within half an hour or 1 hour of birth. And finally, we all know that breastfeeding is the best form of feeding for the baby.